Yes, we are live. Hello, good evening. How are you? Welcome to another session of Ask the Doctors. Happy Sunday. Welcome to the last day of the month of August 2025. How are you? The time is 8:02 p.m. here in Nigeria. My name is Dr. Frederick Unwibohai, a licensed medical doctor. People call me Dr. Fredostar. I'm very passionate about public health education, and we've been on this program for the past 5 years. Every Sunday, we are live on this platform. Today, we'll be talking about chronic kidney disease. We decided to talk about this topic because almost every time people tell you that, doctor, I know somebody who is battling chronic kidney disease. I know somebody who just lost his or her life due to chronic kidney disease. And then we decided to talk about it today. So, any question you have for us concerning this topic, chronic kidney disease, you can drop it and we'll respond to you. Now I'm live on almost all my social media platforms. I'm live on Facebook. I'm live on YouTube. I'm live on LinkedIn. I'm live on Instagram. I'm also live on TikTok. So where are you watching me from? If you're watching me on Facebook, where are you watching me from? If you're watching me on YouTube, if you're watching me on Instagram, on TikTok, do let me know. I want to give you a brief shout out. Okay, so talk to me. Where are you watching me from? Quickly, quickly. I can see some people already. Let's see. Who do we have in the house? We have Abdullahi. Abdullahi, good evening, Abdullahi. How are you? Where are you watching me from? Fabulous on TikTok says Lagos. Fabulous is watching me from Lagos. Angel love it. Angel on Facebook. How are you? Hudson from TikTok. David Leonard on Instagram. Hi, how are you? Okay, so let's briefly. Good evening, Lovett. Okay, Lovett is watching me from Lagos. Glory on TikTok is watching me from Gabon. Hi, is Gabon, Glory. Let's start briefly, or let's start quickly. Let's see. Okay, from Italy. Okay, Clement is watching me from Italy. Gilbert, good evening, Gilbert. How are you? Hudson is on TikTok. David Leonard on Instagram is watching me from Austria. Okay, Kelechi says Facebook. Kelechi, I see you. Oluwatobi Godwin. Okay, so let's start without wasting time. What do you understand by the word chronic kidney disease? I need you to tell me what you understand by that word, chronic kidney disease. Have you heard about it before? Have you seen anyone that had this condition? Talk to me. Drop it in the comment section. I'll do my best to read your comments. Dr. Israel, how far? Dr. Israel, how far? How far? Talk to me. What happened? Why are you not here? Dr. Israel, what happened? Dr. Israel, what happened? What happened? What happened? Why are you not live with me? Oh yeah, now, Dr. Israel, how far? Okay, so yes. So what do you? Let me see. We have a lot of comments on Facebook. Let's see. Good afternoon from United States. Okay, that's Emmanuel Peters. Kelechi from Aba. Sunday from Nasarawa. Dr. Israel, what's up now? Where are you? Where are you? Where are you? Okay, let me drop the link again. Let me drop the link again. Okay. Yes. So Stephen says chronic kidney disease is a situation where the kidneys have reached a damage point where they can't filter waste anymore. Oh, this is a nice one. Good evening. And what's your name? Anistan. Good evening. Welcome. Okay. Now, the reason why we have to talk about chronic kidney disease is because the rate at which a lot of people are having problems with their kidneys keeps on increasing. Whether you are young, whether you are old, a lot of people are having issues with their kidneys. And the funny thing about the kidneys is that when the kidneys are going bad, At the very early stage, there might be no signs because you have two kidneys. And what they do for you is that they remove waste products, they filter your blood to remove waste products. So, along the line, these kidneys could gradually lose its function. And if you are not careful and you don't notice on time, the kidneys could end up going bad. Somebody says kidney disease is a long-term condition where the kidneys, I want to read your comment. Okay, where the kidneys cannot function properly again. Yeah, I like this. Okay. But the thing is that chronic kidney disease does not just occur once. So when somebody says he or she has a chronic kidney disease, it means that it has been going on for a while. But okay, they speak Oyibo God. It means that it has been going on for a long time without you knowing. So it's a long-term condition. Now something where they happen for long without you knowing. So when we say chronic, that is the word. It's been there for a long time. Okay. It's been happening for a very long time. Are we together? Now, it can happen to anyone, and there are some things that can actually increase your risk. Hello, the door. There are some things that can actually increase your risk of coming down with kidney disease, chronic kidney disease. Some of them you can control, some of them are your within your power to rectify. And if you don't do anything about them, one day the kidneys can go bad. Permit me to say that no matter how rich you are, no matter how connected you are, no matter how well read you are, having a problem with the kidneys, especially chronic kidney disease, can wreck you financially. And if you are living in the part of the world where healthcare system is not that strong, where the healthcare system is still crawling, you want to do everything within your power to reduce your rate of coming down with what? With kidney disease. Is that okay? So let's start quickly. But before we start, I need you to share this live session. Share the live session. If you are just coming, you're welcome. We're talking about chronic kidney disease. It's a silent killer. If you're watching me, you have a kidney, and your kidneys help you remove waste products. It will be wise for you to do everything within your power to protect your kidneys. I'm not here to scare you, I'm not here to make you panic. But the truth is that if you don't do anything to your kidneys, if you don't help your kidneys, one day they could go bad. What are those things that can actually damage your kidneys? Commonly, hypertension, uncontrolled high blood pressure. A lot of people have high blood pressure without even knowing. Some people have high blood pressure. And when the doctor or your doctor tell you to do this and do this and do this, we discover that in most cases, you don't listen to the doctor. You want to listen to your neighbor who says, I know somebody who knows somebody that once had this problem and the person did this. But if you control your blood pressure, you protect yourself from what? From kidney disease. Because high blood pressure, uncontrolled, persistent high blood pressure, gradually damages the blood vessels within your kidney. So high blood pressure, uncontrolled high blood pressure of is a very common cause of chronic kidney disease. Now, please listen carefully. If you ask me any question that is related to our topic, I will not respond to you. Is that okay? Dr. Israel, if you are ready, just give me thumbs up. I'll bring you up. If you ask me anything that is not related to the topic, I'm sorry, I will not read your comments. Please take notes. Okay. Now, I mentioned high blood pressure. Now, if I ask you, listening to me, when was the last time you checked your blood pressure? You say, Doctor, I don't know. I don't know. I don't know. Why? High blood pressure damages the kidney. It's the top on the list. The other one is diabetes. Hmm? Uncontrolled high blood sugar. Diabetes as well damages the kidney. Now remember that when you go for checkup, sometimes we tell you to urinate. We want to check your urine. We carry out a test called urinalysis. That urine, we are looking inside the urine to see if there are some things inside your urine that we are not supposed to see. And one thing we look out for again is also sugar, the presence of what? Sugars in the urine. So if you have high blood sugar and you don't control it, you are diabetic and you don't manage it properly, you don't follow the advice given to you by your doctor, by your dietitian, you avoid certain food, you don't care, you drink whatever you want to drink, you eat whatever you want to eat, your blood sugar might be uncontrolled and gradually you destroy the vessels in your kidneys. Um okay. Now, another thing again that can actually damage the kidneys are abuse of medications. Listen to the words I say. I beg you, listen to the words carefully. Abuse of medications. Abuse. There is somebody watching me right now. We have begged you, do not take medications for body pains, analgesics. Do not take them anyhow. The word anyhow means take them when you don't need them. Take them without professional guidance. Oh, doctor, I work and after working, I develop body pains. And every time I develop body pains, I take this medication. Please note that these medications, when you abuse them, they can actually affect the kidneys. Example of these medications are things like diclofenac, naproxen, ibuprofen. They fall into this class. And if you are an elderly man or an elderly woman here, okay, how far my network they act up? Okay, so what we're going to do here, Dr. Israel, I'm going to bring you up on TikTok. Is that okay? So I'm going to bring up Dr. Israel on TikTok live, and then I hope that the people watching us on Facebook will hear you. Is that okay? Hmm? Let me see if I can bring you up on TikTok so that the people on TikTok will hear you, the both of us, while those on Facebook would also hear. So let me bring you up and see. Mm, okay. How far? Now, the people on Facebook, let me know. Dr. Israel, how far? How far? Let's see. Let's see. Let's see if okay. How you doing now? Happy Sunday. Now, the people on Facebook, everybody watching me on Facebook and Instagram, can you hear Dr. Israel? If you can hear him, Dr. Israel, please talk again. Greet everybody. So let me see if they can hear you. Good evening, everybody. Happy Sunday. I'm still trying to join on Facebook. I hope it works. Yeah, I think this is very clear. The Facebook is acting up for you. You understand? It's acting up for you. But this is very, very clear. I can hear you loud and clear. Let's see if the people on Facebook can hear you. So if you can hear Dr. Israel, everybody just put in the comment section yes. And if they can hear you, I don't think you should switch to Facebook, at least for today. No, I don't want to switch. I wanted to be on both. How I want to? You go the echo now. You go the echo. Okay, okay. Wait. Did he hear you loud and clear? Yes, we can hear him. So you are very loud. But if you can join, still join, then mute that one on Facebook. Then, still try and join. Okay, now. Yeah. So I'm going to hand over the floor to you quickly because before you came in, I already spoke about what chronic kidney disease is and how common chronic kidney disease is in our environment. Hmm? And then I oh, hello. I can hear you. Okay, good. So I can you are on Facebook, but mute your the one on Facebook, eh? Thank you very much. Okay. So I'm going to hand over the floor to you, please. I also talked about the causes of chronic kidney disease. I started with I started with hypertension, I started with then diabetes, and then abuse of medications. The floor is yours. Please continue.
and we decided that it's something we should talk about. And I believe that the friend have defined it. It's a progressive thing, not a one day thing. So it's a progressive problem when they say you go start small, from small. Before you know, it don't turn big thing. And this chronic liver disease is
Kidney
divided
disease.
into 5 stages. Yes, chronic kidney disease. Sorry, I tell you, chronic kidney disease is divided into 5 stages. Yeah? Stage 1 to stage 5. Now, I know we're going to bore you people with the names, the different. So I just wanted to know that stage 5 now what they call end stage kidney disease. When we say the kidney don't go finish. So neither one be. Now, the problem is now sometimes our lifestyle and they contribute to the problem, waiting they cause this kidney issue. So now make it good say we will need to know what kind of things what will they do. Now when they talk about chronic kidney disease, they mean say there's also something called acute kidney disease. So kidney disease in a way is divided into two, the chronic and the acute.
Yeah.
So now the chronic we dey talk about today, and it's very, very common. And what is the main culprit? What is the main culprit of this chronic kidney disease? Now, hypertension and diabetes are the main culprits. When we say main culprit, people will get hypertension and people will get diabetic. They likely quickly they get kidney disease, and then they get kidney disease. So that make them be the main culprit. But there are other things where if you see make person come down with kidney disease. There are other many problems. Yeah, when you make people come down with that. So the funny thing is that when it start, people feel not know say they get kidney problem because as we said, if they start gradually, so you know they start one say from the beginning you just turn chronic. What's the meaning of the word chronic? Chronic means long term.
Yes.
Something where they body long term. So because you know they start once.
Yes.
When it starts, some people feel never know say they don't get time, they don't get sign,
At
they
all.
don't get symptoms,
At all.
they don't go feel anything.
At all.
They go just they say that normal, they are still doing their normal activities.
Yes.
So because of that, they'll think say nothing they do them.
Yes.
Dr. Fred, are we still together?
We are very much together. We are very much together. If you can hear Dr. Israel on Facebook, also let me know. I can hear you loud and clear. Please continue.
Okay, so now one thing we will need to know. So make I just use the opportunity talk a few things about the risk factors. Now the risk factors. When we say risk factor, we dey talk about those things where they make person they quick come down with kidney disease. In this case, chronic kidney disease. Those things where person go they do. We go make person quick come down with that. One, we don't already talk say one of the two major culprits now hypertension. People will get hypertension, people will get diabetic. Yeah, they likely quick come down with chronic kidney disease. Another people and those people where they use some medications and where they're on some medications and then they take that medication for a very long time. This kind of person still come down. Another thing the genetic, sometimes genetic, and sometimes the kidney itself get abnormal shape and abnormal morphology. ITB, God take create an IT form for your body. All those are facing make some persons come down with chronic kidney disease in the future. Now those they drink alcohol, they like say they know they use them. Once they see alcohol, that be the best thing for their full life. They are also pushing themselves to chronic kidney disease. Even smoking as well can also lead to that. Now, for this heart disease and some problem of the heart can also lead to kidney problem. So in fact, kidney and the heart, sometimes they work, they sometimes they intertwine. Some problem will go affect the kidney. If you don't too worse for the kidney, the heart will go collect the problem. Then the same thing, if the heart get problem and it does it too much, the kidney will go collect. If let's say they help each other, but unfortunately, not be better help. Neither they help each other. So the friend, let me leave you first to continue.
Thank you so much, Dr. Israel. If you just the watch, if you're just coming, we're talking about chronic kidney disease. It's very common, no matter how rich you are, no matter how educated you are, if you don't protect your kidneys and if for whatever reason your kidneys fail, it might wreck you and your family. And if you live in developing nations, you should pay attention to what we are talking about. Dr. Israel has mentioned the causes. Alcohol, smoking can damage the kidney. Permit me to add something that also damages the kidney. And I'm going to say it emphatically with all sense of confidence. Herbal concussions. Read my lips. Herbal concussions. Multiple researches have shown that about 96% of the people who come down with chronic kidney disease, they discovered that they do take herbal concussions. Now, how does this happen? I'm taking down my time to explain why this happens. Herbs are not bad. Herbs are not bad. Or herb no dey bad. But the problem with the herb be say, or the problem with herbal concussion is that the people that make some of these herbal concussions, they mix them with rubbish chemicals that you don't know. And some of these things are dangerous to the kidneys. You have no idea. And when you take them gradually, listen, gradually the kidneys begin to go bad. It will not go bad today. But doctor, now our forefathers have been taking this stuff and nothing happened to them. How are you sure nothing happened to them? Have you taken out your time to travel and go to kidney centers and see people and interact with them? So one common cause again of kidney disease, chronic kidney disease, is herbal concussions. Is that okay? We move to the next discussion. How would you know you have chronic kidney disease? What are the signs to look out for? God forbid, I will never have kidney disease. This one is not God forbid. You have to be practical. You have to do your own part and then allow God do his own part for you. Before we talk about, I'm going to hand over again to Dr. Israel to continue. I'm trying to moderate. I'm looking at, remember, we are live on Facebook, we are live on YouTube, we are live on LinkedIn, we are live on TikTok, and we're also live on Instagram. And I believe you all can hear myself and Dr. Israel. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time, every Sunday. And we've been here for the past 5 years, every Sunday. So if you're just coming, you're welcome. Do well to share this video. Share and invite your friends. Share, I mean share. So Dr. Israel, let's talk about the symptoms. Waiting person go see for him body to know, say, be like say this kidney don dey spoil or the kidney still good. Please, over to you.
Okay, before we talk that symptoms, let me just add one thing when physics cause when physics the risk factor. This one, if let's say, I think this one 900 the things where they make many people they get this kidney disease well, which is cream when we they use.
Thank you for adding that. Thank you. Bleaching creams.
Bleaching cream when we they use. So that has really become something where we say some ladies one become white overnight, a lady that is dark one become white overnight.
Not even ladies, not even ladies, even some guys.
It's also all in the name of
Hello. Hey, network. Okay. Dr. Israel was talking about the bleaching cream. The chemicals in those cream can damage the kidney. The chemicals in those, Dr. Israel, what happened to your TikTok? What happened to your TikTok? Oh yeah, now come back, come back, come back, come back to TikTok. Oh yeah, oh yeah, yeah. Please. Oh yeah. Uh. Okay, I've sent you a request. I don't know what happened to your TikTok. Sorry, sorry. I don't know what happened. I'm trying to bring him back on TikTok so that everybody, those on TikTok, those on Instagram, those on Facebook and YouTube, will as well hear him. Hmm? You understand? So I'm trying to bring him up. Now, somebody's asking us, can you talk about some of those creams that cause kidney problem? I'm not here to mention those brand name, please. I'm very careful and we are careful. But if you know those cream, when you buy them, they will tell you you will be white in 24 hours. You will be white in 1 week. You will be white in 2 weeks. They have specific names. You know them. They draw ladies and guys with very white skin. Do you understand? So when you some of the herbal sorry, the creams and even the soaps, when you rub them on your skin has what we call pores. Pores. We call them pores. These creams they penetrate your skin. And when they penetrate your skin, they also go into your system. Um, your body absorbs them, it moves around. What they do is they begin to settle also on the kidneys. When they settle on the kidneys, let's see what's going on, Dr. Israel. Okay, let me see. Are you back? Can you hear me?
Yeah, they hear you.
Okay.
I don't know. It just went off.
Okay. So now Dr. Israel is on Facebook. Dr. Israel is on Facebook. He's no more on TikTok. But if you can hear Dr. Israel on TikTok and Instagram, let me know. Dr. Israel, say something. Let's confirm.
Yeah, it's like I'm back
Okay.
on Facebook.
Yes, yes, we can hear. Okay, they can hear you. You were talking about the bleaching cream. I had to go further, explain what happens, the mechanism of action, how bleaching cream do cause kidney problems. So if you are a lady, if you are a young man and you use those cream, you want to get white overnight. I don't want to call any of their name, I beg, I don't get power for them. Those things can damage your skin, organic stuff and the rest. Please, let's talk about the symptoms, then we can take questions.
Okay, yeah. Now, the first thing you should know is that symptoms, because we say it's a chronic disease. Every chronic disease at first, not they get symptoms. We they call am asymptomatic. So when they start, they'll be like say they not get symptoms at all. So until they come, they go. And before you come, they see symptoms. And symptoms when you go,
Mm,
they see sometimes you get fatigue, that is tiredness. The person go they tired, uh, and the person go come they get swollen legs. You go wake up in the morning, if eyes go swell, if he urinate, the piss go dey foam. At first, they'll first start with many piss, but as time goes on, they fit not even come dey see piss, dey piss again. And sometimes their body fit dey scratch them, their knee go swell, they go fit dey get fever. Sometimes they go dey get difficulty in breathing because fluid don many for their body. Now, wetin
mm,
be the function? Because the kidney no dey fit do e function, and which is wetin be their main function na to remove waste from body. So when dis thing don happen, dem no go fit do all those function again. And another function of the kidney na to make sure say our red blood cell dey multiply, because they get one hormone when the kidney dey produce wey dey make that thing dey happen. So when the
mm,
kidney don get problem, that hormone will not be produced, that chemical no go dey produced again. So
mm,
most person fit still come dey get wetin we dey call anemia, shortage of blood.
mm,
Shortage of blood. So once you dey see all these things, swelling eyes, leg dey swell, body dey weak, tiredness, dem dey get difficulty in breathing, then e fit just be say na kidney problem na this person get so. Dr. Fred.
Thank you, Dr. Israel. Permit me to add some other stuffs. Even the blood pressure fit con dey high, the BP,
Yes.
the blood pressure fit dey high continuously. And then one other thing wey we con notice be say sometimes you fit just dey feel
funny, you no fit pinpoint wetin dey happen. You come dey talk say I dey always get malaria, typhoid, malaria, typhoid, malaria, typhoid, because I don see somebody wey be say dem dey treat am for malaria, typhoid, malaria, typhoid, malaria, typhoid, not knowing that the kidneys were actually going bad. By the time they discovered that it was kidney problem, e don enter end stage. The person come dey find renal transplant. So we dey always beg you, if you dey lis ten to us this night, lis ten carefully. When we dey talk with all confidence and humility. If you notice say you dey get any of these symptoms, go to the hospital, see your doctor, make dem check you and find out what is happening. Do not sit down and be on internet looking for answers. Can you tell me? And then somebody will tell you rubbish that will end your life or worsen your problem. So whatever we are telling you here, we're not saying because we are talking here, oh, we want you to now come and call us so that we can treat you. No, we're not here for that. We are strictly here to ensure that whatever is going on in your system, it doesn't worsen. You don't take it for granted and you see your doctor. You might be having anemia, low blood, and your low blood might be from nutrition. Maybe you know dey chop well. So because say you get low blood, we no talk say your kidney don spoil. You dey hear me so? Because say oh you go urinate, you come see your urine dey foam, we no talk say your kidneys spoil. Lis ten carefully, because social media people sabi manipulate information. They dey interpret am in their own way. That is why we take our time to break am down, even in the most simplest form for you to understand. Is that okay? Now, if person kidneys don dey get these signs, is it true that the kidneys as e don start e go spoil? What if e dey at the very early stage? Hope dey for this person. The answer na yes, especially at the very early stage. If you pick am early, that is why we dey beg you, Africans, especially Africans. I'm not here to talk to Oyibo. Make dem, I'm not here for them. I'm not here to go global. I'm here to talk to Africans, and that's what we are here to do. If e dey at the early stage, and dem pick am early, your doctor fit help you make e no progress to the next stage. Oh, these things and these things wey you dey do, na im dey make this thing bad. If you stop am, we fit delay. Your nephrologist go help you. But if you ignore, e fit come move from stage one to stage two to stage three, to the point wey be say you go come dey need dialysis. And remember, dialysis is not cheap. Dr. Israel, let me also hand over to you to talk more on this, and then we talk about little the diagnosis, maybe advice, prevention, and then questions.
Okay, and the thing is this, e dey very important for us to understand that kidney problem is not be child's play, not be child's play. As Dr. Fred write for there, is a silent killer, not be child's play. And sometimes once e come, once we hear chronic kidney disease, sometimes we go just tire. We in the medical field, sometimes some of us go just tire. Mostly for those places wey dey Africa side, this okay, let me not say Africa side, let's just say low and middle income countries. Let's use
Yeah.
let's use that word. Make them some of the time some persons go just tire. Okay, so we don't mention those signs and symptoms. It doesn't mean say once you get those signs, it means say you don't already get kidney problem. No, it means say you should go and check yourself. And how you take go check yourself now to go hospital. You see your doctor. Your doctor can actually tell you say maybe you go see a nephrology based on the question when you go, other questions when you go ask you and how you take answer those questions. They go do urine test for you. And that your urine test, they go to check whether protein go dey your urine. Because
Mm,
normally we're not supposed to see protein for urine. We're
yeah.
not supposed to see protein for urine. So when we start to dey see protein for urine, we go to think so many things. And we go to
Mm-hmm.
think so many things. Now we know say there are other conditions when protein fit still dey urine. That's why I say when we see protein for your urine, we go to think so many things. We're not go just dey think kidney failure only. But we go to think so many other things. Say, oh, and one of the things when we dey think now still this chronic kidney failure. So that urine test alone can actually help us, like give us a guide. Then another test when we go do, we fit even base.
Okay, we have a problem with Dr. Israel's network. I'm going to wait for Dr. Israel to join us and then make I take one question. Somebody they asked on TikTok. Somebody's asking us on TikTok. Your name is Cherry Cherry Coco on TikTok. Please, how can the kidney be detoxed? How can the kidney be detoxed? Listen carefully to my answer. The kidney is among the organs for detoxification. The kidney they help you comot toxin. So to remove toxin. If you want to help your kidneys, make your kidneys detox because your kidneys dey comot toxin. You no fit detox the kidney. The only thing you can do is for you to support your kidney, make your kidney fit dey comot toxin. You no fit drink any tea to detox your kidneys. No. What can you do to help your kidneys, make your kidneys fit detox? Number one, drink water. Drink water. I find it difficult to understand why you dey like to drink alcohol after you know say alcohol go spoil your kidneys, but na your life. Wetin concern me? Na your life. It's your life, honestly. But alcohol go spoil your kidneys. You understand? Another thing again is that eat healthy. Avoid all those processed food. Avoid all those foreign oyibo. You want to appear foreign, like you dey enjoy life. You dey damage yourself, dey go. Eat more of our natural stuffs. Eat vegetables. Eat fruits. Eat our normal food. I'm using the word normal wherever you dey watch me from, whether you dey Nigeria, you dey Ghana, you're in Cameroon, you're in South Africa. You understand? Eat. Reduce the consumption of processed foods. Why? Why is this important? All those things, after you process them, they dey get some kind small chemicals, free radicals, wey fit damage the kidneys. Avoid all those sugary drinks. If you say make we no drink alcohol, if you say make we no take sugary drinks, wetin make we drink? We suppose wose you. We suppose wose your left ear so that make your left ear dey make noise for 2 days, then you go get sense. Drink water. You can take zobo. You can take um kunu drink. You can take tiger nut drinks. All these ones, you fit take am. But the one wey dey your body na those ones wey dey bottle, wey dem package, na you like. You wan drink am, drink, no vex, drink. But remember say when the problem come enter, when the problem enter, na you go suffer am. And that thing again you need to do to help your kidneys again is that all these medicines, doctor, my body dey pain me, I dey drink body pain anyhow, I don dey drink am up and down. Small, dey spoil the kidneys. If you are obese, if your body mass index is very large, on the larger side, try to exercise and cut your body weight. These are the ways you can help your kidneys so that your kidneys can help you detox. Is that okay? But you cannot say you want to drink something to go and detox the kidneys. No, you can't really because the kidneys just dey there to help you detox. So you cannot detox the kidneys. All you can do is to make sure you just take care of the kidneys with these simple stuff I have mentioned. Dr. Israel is back. Over to you. Network. The network. The network is not friendly to Dr. Israel. Another thing to avoid is energy drink. Yes, energy drink. Thank you for mentioning that. Energy drinks. Please share the live session. If you dey watch this video, you cannot detox your liver. If you dey watch this video, share the live session quickly. Let me take one question on Facebook. Let me take one question on Facebook. Let me see questions on Facebook. Let me see. So I just mentioned the ways to help your kidney. Also, go for checkup. Go for checkup. Always go for checkup. Okay, I'm looking for questions. Let me see if I have any questions on. Let me see if I have any questions on Facebook. Let me see. Okay, Dr. Israel, can you hear me now? Okay, let's see. Dr. Israel, they get problem with in network. Can you hear me?
I can hear you.
Okay, fine, fine. Now we can hear you. So please continue.
Okay, where we stop?
We stopped. Where we stop again? We did talk about. Uh okay. So for me, actually, I had to talk. I had to take a question. Then we are going
Yeah,
into
okay.
how to take notes. Say the kidneys don't spoil.
Okay,
Diagnosis.
yes, we
Yeah.
were talking. Yeah. So I'm going to talk about the estimated glomerular filtration rate when we go fit do that one. I'm really waiting go fit tell us if the kidney really don't dey go or if the kidney is still working fine. And that one I'm go fit give us the how the kidney don't go reach. And that go fit tell us how the kidney don't go reach or if the kidney never go far. So when you do that test, EU creatinine, all those ones, electrolyte, urea and creatinine, if the urea is high and the creatinine is high, you know, say, oh, problem don't the day. And that one also determine maybe the sodium constantly low. All those ones go see determine if we go do dialysis and all that. So we'll talk about these are just ways to take find out um, whether the person don't they get kidney problem. They will come stage the kidney problem, whether not chronic or whether not acute kidney problem. Dr. Fred.
Yeah. Thank you. Let's take some questions and then we'll round up. Please, if you dey if you just dey come in Nigerian time, myself and Dr. Israel, we've been on this program for more than 5 years every Sunday. All we do here is to teach. So the only thing you can do for us this on this platform is share the video, share the live session. Don't ask questions if you will not share. You understand? If you no go share, no ask us questions because you have to support us too. Because many people no go get time to do like this to help you answer questions. So share the live session and then we also will do our best to respond. Now, somebody is asking a question. Why do children also have kidney problem? Why?
Yeah, most of the time we know the quick talk about kidney problem for children. But yes, children also they quick come down with they still they come down with kidney problem. And one of the things as I said, when the genetics, remember I mentioned the word genetics, so that can be one. Another thing when the children get some diseases of the kidney during their young age, then you fit make them get kidney problem, chronic kidney problem. And another one pikin when get maybe infection, malaria, all those things will come lead to anemia. Come like say their kidney come dey fail through that process, fit still lead to chronic kidney issue later in future or even within that period. So that's just some of the things when we fit make children come down with that. And sometimes the medication wey we dey take and medication wey we give the children, sometimes if it be say some things wey the mother even take when the pikin dey belle, fit still be another problem wey go cause issue for the child when you don't give birth to that child.
Okay, thank you, Dr. Israel. We are streaming live on Facebook, on YouTube, on LinkedIn, on Instagram, on TikTok. We have a question here on Instagram. Let me take a question on Instagram. I see your question. It says, my question is, can a renal patient live well and probably long on dialysis, considering how expensive kidney transplant is? So Can someone who has been on dialysis, can the person live well and live long? Okay, the answer is yes. But this yes is tied to so many factors. Number one, yes, where? For someone with chronic kidney disease on dialysis in developed societies, you will notice that the system is structured that this person can access dialysis without draining his or her pockets. But in this part of the world, in low and middle income countries, number one, we don't have enough dialysis center. Number two, it is expensive. Most times people can't afford it. Number three, uh, what again? They can't really go for checkup. But in a society that is well structured, that has dialysis center everywhere, there are people that have been on dialysis for 20 years. Yes, I have had contact with people that have been on dialysis for a very long time. But in this part of the world where healthcare workers go on strike, in this part of the world where machines are not readily available, where Jakpa healthcare workers are traveling, we have reduced manpower. The tendency that somebody with chronic kidney disease on dialysis living long is very low compared to somebody living in developed societies. Is that okay? Dr. Israel, do you have anything to add to that?
Yeah, Dr. Fred has actually you said it. That's it though. But as Dr. Fred said, the answer na yes. So if you dey middle class or low income class countries and you have the finance to do everything, yes, you can. The person can live an healthy life. And it's not just doing the dialysis alone. That's not the only the thing. You also need to do a lifestyle modification.
Yeah, thank
You
you for
also
that.
need to change so many things that you do. Some food you eat, stress and all that. You still need to change most of those things. So when you do that, because if you don't give the kidney too much work, even the dialysis no go see many things to dey remove. You understand? So that's just it. What the dialysis does is just to take over the kidney's function and to help the kidney remove all the waste when the kidney is supposed to remove. And sometimes it's not easy because you also have to, if your PC will not reach the level when they'll do dialysis, no problem. So there are so many other factors that also covers that dialysis. However, even when you are doing the dialysis, you can actually live a healthy life if you keep to other rules and regulations that will also help to safeguard your kidney.
Thank you, Dr. Israel. Before we continue, let me talk about something that is off the topic, and that is for my course. I have a course. I have seen a lot of people follow me online, on Facebook, on TikTok, on YouTube, on Instagram. I made a course, and some of you, especially on Facebook, you are destroying your page. Some of you, and if you're on the internet, you have to be brutal and be selfish. Sometimes you are destroying your page. You are posting people's content on your platform. You will destroy your page. You post my videos on your page. You will destroy your page. I have begged you severally, but I noticed that a lot of people don't have knowledge. So if you know, listen to me. If you know you are a content creator, you just started, you want to grow online, you don't have any guidance, go and get my course. I'm saying this not to beg you. If you cannot get my course, fine. Go and get other people's course or courses. Get it and learn so that you don't suffer. Why did I deviate? It's painful that you work hard on social media, on the internet, and one day you cry. You want to make money online, fine, it's okay. But without the right knowledge, you will suffer. And I don't want you to suffer. You can decide not to get my course. Fine, I'm not here to beg you to get it. Get other courses and learn. But if you want to get my course, there's a link on the page. Look for the link on TikTok, on Instagram, on Facebook, or send me an email. My admin will give you the details to pay and get the course. Get it. I say get it. Listen to me, look at my face. Get am. When I dey talk, I know wetin I dey talk. Go and get the course. E go help you so that you no go suffer. Come dey beg me, Dr. Fredostar, this has happened to me. What do I do? and you know we are very busy. I beg you, go and learn now. That is the little information I want to give to you. Let's take one more question. Somebody is asking, if the kidney problem is discovered early, can it be reversed? Dr. Israel, over to you.
Okay, when the kidney problem is discovered early, the progression, right, can be halted. Yes, it can be halted, and the kidney can still serve that person for as long as the person wants to be. However, as I said, when they discover something, then your doctor come tell you, say, see what you they do, what you should be, what you supposed to they do, and how often you they come for a checkup. You can't decide, say, yes, I don't wear, I know go again. It means say you want cause another problem for yourself. I've seen a case. In fact, recently, not even recently. Let me say today, there's somebody I saw today that complain of something. He said the thing they always do. After the my colleague treat her, they tell us say me go do one investigation. He not go do one. He came to meet me with same complaint. I told me that they tell me may I do this investigation, but I not do, and I ask why. He said because I can't notice say I don't find. Nothing can they do me again. I just rest.
Mm-mm.
So I was like, you see, if you have done that investigation, maybe we would have no other things to do for you. And now I'm still sending the person for the same investigation. Investigation where you supposed don't do since. One for don't you still make decision and all that. So why they talk to say that nothing say, oh, because you don't wear, the kidney thing don't reverse, no need, make I go stay in my house. No. Once your doctor give you appointment, please go for your appointment, and with that, your kidney you can stay with that same kidney for as long as you want to stay.
Okay, let's take one more question. We are almost out of time. If you are just coming, you're welcome. Talking about chronic kidney disease. Okay, let me see. Somebody's asking, how can someone on dialysis get healed and stop dialysis?
When your doctor continue doing the dialysis for you, they will be doing some investigations, and they do those investigations to check the level of your kidney, whether your kidney don't get power again, whether your kidney don't ready to take continue work when it's supposed to they do. So as long as they do that dialysis, they check the kidney. If the kidney don't respond, say yes, he ready to do the work, they will stop the person from dialysis and the work will continue. As I talk, remember when I give every talk like this, I will always add by saying they will also continue appointment or continue to say maybe they come hospital, come they check. I know somebody when they do dialysis, it started with every day. Later it's now 2 times a week. Later it's now once a week. And recently now is once a month. So we believe say as time goes on, if even come be once a year or later it can just be no more dialysis. So it's possible, but all is all about you going for checkup regularly. With that, it's possible.
Yeah, possible. But there's something we be say somebody need to understand. We no want make the thing enter end stage. Wetin they call end stage. End stage renal disease or end stage renal failure. If kidney problem enter end stage, e simply mean say this person na kidney transplant go help am, or e go dey do dialysis dey go. End stage mean say the kidney no fit come out from that damage wey don do am. But if na early stage, as Dr. Israel talk, yes. So the thing is make e no enter end stage. But if na end stage kidney disease, meaning say the kidney don go, we need to put another one for am or use dialysis for the person make e dey help am because im kidney no fit come out. Everything wey we dey talk for here, we are talking based on profession, medical profession. I know somebody will talk, miracle can happen. What God cannot do does not exist. It's possible, no problem. But based on medical literature, I beg. This is it. So if you know somebody will get early stage, stage one, or even stage two, I beg, make e see in doctor nephrologist, make dem check am. Hmm? Okay. Let's take one more question. We are almost out of time. If the urine has one plus protein or has plus one protein, can it be reversed? Dr. Israel.
Yeah, when the person get one just a plus of protein doesn't actually mean that the person get kidney problem. Remember, I told you say when you see protein in urine, uh, we go dey think so many things. So sometimes there are some things that will make that protein the urine, and yes, it can be reversed. It can be reversed if the kidney is still working perfectly. It can actually be reversed.
Thank you. Can actually be reversed. Let me see. One more, and then I think we should round up. Let's see. I'm checking. Remember, we are live on Facebook, YouTube, Instagram, TikTok, LinkedIn. Let's see. I'm checking, I beg. Okay, doctor, this is from Peace. What if it's only one kidney that is affected? What should the person do?
Now God is so wonderful that He gave us two kidney. Eh? In fact, it's a gift to us for us to have two kidney, because normally someone can actually live a good life with just one kidney. So far, you know they do pass yourself. So if I don't talk this one, it means say I don't answer your question with style. So once we dey talk about chronic kidney disease, you know say it don't affect the two kidneys. So one kidney no fit just dey affected and it will bring the person down completely. And because the other kidney will carry out the function. As I said, the two kidney na a wolf, na gift to us. Human being can live with just one kidney so far you not do pass yourself. So what you just need to do when you go test and they find out, say, oh, see, now one kidney not dey bad, oh, the doctor will tell you what to do. Your lifestyle, you need to modify your lifestyle, change so many things so that one kidney will remain will dey safe. That's why people can donate kidney and nothing to them. Because yes, you can live with one kidney.
Thank you so much, Dr. Israel. If you just did come, if you are just coming, you are welcome, but you came very late because we are out of time. We talked about chronic kidney disease. We spoke about what is chronic kidney disease, what are the causes, who can be affected, what are the symptoms. And I also mentioned how you can protect your kidneys, how you can take care of your kidneys. If you're just coming, please go back and watch from the beginning. It will help you. No come late because we know they joke with our time online. We dey work with time, 1 hour on Sundays, every Sunday, 8 p.m. to 9 p.m. Me and Dr. Israel, we dey here, they teach. Sometimes we dey answer questions. But today we talk about the kidney. I beg you, we no talk say your kidney don't spoil if your urine form. We no talk say your kidney don't spoil if your blood pressure high. All we are saying is don't joke with those symptoms. Let a medical professional check you. No sit down for social media, on internet, TikTok. You dey ask somebody, they tell you say go and buy this and drink. They go just end your life. Be careful. And we are here to ensure that you take your life seriously. So I beg, do well to speak with your doctor, make dem check you. So Israel, any final words?
Okay, my final words is I want to say a very big thank you to everybody when they follow us. They follow Dr. Fred and myself. Um, Thank you so much. Today we'll discuss kidney problem. Next Sunday, we never know what we want to discuss. So if you dey here and you think say there is one thing you would like us to talk about, before we end this live session, you can just drop it for us. We will look at it and see if we can talk about it. I hope you don't, because to get to get a topic, the lazy. And we like to get topic that we cut that everybody will benefit from. So we not just want take a topic when we say now let me with Dr. Fred go the talker. Now let me with and go understand what we the talk. And some of those things nobody they even experience and for everybody where they with us. So if you know one or two topics that you think is very good for us to talk about that you even want to know of, please you can drop it so that we will talk about it. Thank you so much. Where you they follow myself and Dr. Fred, where you they always deal with us every Sunday by 8 p.m. They listen to what we tell now.
Thank you, Dr. Israel. Thank you very much. As I round up, I want to say a very big thank you to you, Wade Watch, spending your data here. We did grateful. For you, we comment, thank you. You we share, we invite your friends. God go bless you. They no go collect your husband, they no go collect your wife, they no go collect your boyfriend, they no go collect your girlfriend. Your pikin go succeed. From the depth of our heart, we did grateful. I mean now, we know they take them for granted. I beg you, listen, I beg. We no one here say after you listen to us finish, you can't go careless. Something can happen to you. Always speak with your doctor. And then for those people will be content creators like me, eh? I no want me you suffer how I did suffer when I start. So go and get my course on content creation. You no go regret. It's very cheap, very very cheap. Watch the course, get the course, and when you get am, you go come back and tell me thank you. So I no want me you suffer, whether you be man, woman, elder or young. Go and get my course this night. Send email, make my admin give you the details. Remember, like I go always tell you, good life now waiting. Good life. Good life, everybody.
Nonsense.
Good life. Na sense. See you next week and have a wonderful evening. Bye bye. Au revoir. Odabo. Kachifonu.
Dio.